Good evening, everyone.
Good
You see
evening.
going?
Good evening.
All right, I'm making sure it has streamed. Good evening, everyone, and welcome to a summer series that we are starting here at First Nazareth, where Blakely and Scott is pastor, called Some of This and Some of That. Where we're going to be discussing a variety of topics that pertain to our overall well-being. As far as the work in the kingdom, we want to make sure that we are taking care of our temples in all aspects. And today we are thankful to be discussing health and nutrition. And we have local and very local to First Nazareth and the Columbia, South Carolina community, um, experts who are willing to share their insights on how we can live better, live long, and live well. And so we are thankful, thanks to the works of Sarah Gay and Dr. Kendria Cartilage with our health and wellness ministries here. We are thankful to have Colonel James Palmer, who is going to lead us in prayer. Dr. Cedric Rivers, who also works with our health and wellness ministries, to be discussing men's health. We also have with us Veronica Deese, who's going to be discussing how to prevent diabetes. And also, we are thankful to have a demonstration on having a salad in a jar by Ms. Faith Palmer, who's going to give us a nice demonstration. So we've got some very helpful, insightful, beneficial things to learn. And we thank you all for joining us. Don't forget to press share so we can all learn from each other and we can share all the things that we are learning today. All right, Colonel Palmer, are you ready to pray us in?
Let us pray. You can hear me, y'all. Let us pray. Most merciful God, our Father, we thank you for this day. We thank you, God, that you woke us up this morning with the blood still running warm in our veins. We thank you, God, for this wellness hour. Lord, your word reminds us that our bodies are temples of the Holy Spirit. Your word also says if you eat or drink or whatever you do, do everything to honor God. And it says also, let your bodies be a living and holy gift given to God. And once again, God, we are reminded that it's not only your desire for us to be prosperous and wealthy, but it's also, Lord, your desire for us to be healthy. And Lord, I just pray that you would just bless each and every presenter that is on the line today. And I just pray that it was a blessing to all those who will hear the knowledge and expertise of our presenters today. And we ask your continued blessing upon the wellness ministry. And we ask all of this in the mighty, marvelous, and miraculous name of Jesus, who is our Lord. And all the people of God said together, amen.
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 And I believe before Dr. Rivers shares his insights on men's health, I think we're going to have Dr. Kendria Cartlidge kind of share a few words on behalf of the Health and Wellness Ministry.
Good afternoon, everyone. Thank you for taking part of your day to join in this presentation. I am the president of the Healthcare and Wellness Ministry at First Nazareth Baptist Church. Our aim is to provide health information for the congregation and surrounding communities to to help improve their overall health and impact their families as well. Thank you to our speakers we have tonight that are discussing some vital topics that are very important to the community and the congregation. We hope that you find something that you learn that will be helpful to you and your family. And definitely, if you learn something tonight, feel free to share it with someone else and encourage them to come back to some of the other series that we will have coming up in the subsequent weeks. Thank you.
Thanks, Kendria. All right, Dr. Rivers.
Yes, ma'am. All right, great. All right, thank you all for having me tonight. Like I said, I'm Dr. Cedric Rivers, currently working as a hospitalist at Prism Health Richland, and with Cedric Rivers, currently working as a so with June being Men's Health Month, I want to speak a little bit about issues that are pertaining to men in particular. Of course, everyone can benefit from this information as well. So I'm going to attempt to share my screen. Let's see. Sorry, I'm trying to figure this out here. Can anyone see the slides?
Yeah.
So you said you can see them?
No, sir.
Okay. Tonight we want to talk about some mental health issues as well. So we'd like to start off by talking about men's health and why are we here? Why are we having this discussion? Unfortunately, history has shown that men in general are less likely to go to doctors to seek medical care and to continue with regular checkups. In addition to sometimes the fear of going to the doctor, there's also a history of not really trusting providers in regards to medical care. In addition to those aspects, we also have sometimes socioeconomic barriers. Life is expensive. Unfortunately, sometimes many don't have insurance coverage to go to the doctor for routine care. In addition to those things, we also have issues with risk factors that we have that we won't realize how it impacts our livelihood. Some of those things could be tobacco use, alcohol use, and decreased activity. Statistics have shown in regards to tobacco use, 13% of men 18 and older smoke. And we know those are risk factors for heart disease and lung cancer. In regards to high blood pressure, out of all men 18 years or older, 50% of them have high blood pressure, either on medication or not diagnosed as of yet. And in terms of obesity, we know weight plays a big part in a lot of health issues. And in the ages of 20 or more than 40% of men are overweight or obese. As we look at these numbers, we also know that as African-American men, we have a greater risk of developing diseases as compared to our white counterparts. And so it's really important for us to really step in and take control of our health to live a longer, healthier life. So one of the big medical issues regarding men, of course, is prostate cancer. In regards to prostate cancer, it's the second leading cause of cancer death in men. It's deceptive because with prostate cancer, a lot of people don't display symptoms until it's far advanced. The prostate is something that sits between your bladder and it surrounds your urethra. It's about the size of a walnut. But as time goes on, it can get larger, which when you hear a lot of people talk about an enlarged prostate. That is not cancerous. However, prostate cancer can occur, especially over age 50 or more. So with the screening tests, before the biggest emphasis was placed on what they call DRE or digital rectal exams, where they insert the finger into your bottom and feel around your prostate. It should be smooth, but in cases of prostate cancer, there could be a nodule. But studies have shown that sometimes these exams don't give the full story. And depending on the technique, sometimes things can be missed. And so the biggest screening right now for prostate cancer awareness is a blood test called a PSA, which stands for prostate specific antigen. And you start getting this test usually starting at the age of 40. It's a yearly blood test, and they can monitor your levels. As they see if your normal should be 0.5 to 4, as they see that number increase over time, then that suggests that there could be something going on with your prostate. And then at that point, that's when they would look at performing a biopsy. Unfortunately, from working as a hospitalist doing inpatient work, I've seen a lot of people come in with prostate cancer and they really didn't have any symptoms whatsoever. So a simple blood test can give you and your provider the information they need to take the next steps to hopefully prevent you from having to deal with this deadly disease. Next, I would like to talk about colon cancer. This is something that we're all familiar with, and unfortunately, some of us have close family members or relatives that we know who this has affected personally. Prostate cancer is preventable. With this type of disease, before the recommendations were to start doing colon cancer screening at age 50, but we've seen that there are many people being diagnosed with colon cancer at earlier ages, and no one really knows why. So recently, they've changed the recommendations to start getting colon cancer screening at age 45. If you have a close relative who's been diagnosed with colon cancer, the recommendations is to start getting screened 10 years earlier. Colon cancer, with the screenings, they have a test called a colonoscopy where they give you a prep to drink the night before, cleans out your system, and allows the physician to get a direct look into your large intestine, or also known as your colon. If they were to see something called polyps, which are like overgrowths of tissue, they can biopsy it and then send it for testing. Polyps take 10 to 15 years to become cancerous. So if you're getting your routine screenings every 5 to 10 years, depending on your situation, they can detect it and prevent you from having to deal with this disease. A lot of people are fearful of having the colonoscopy screening, but there are also other testing that they can do, mainly called a new test called Cologuard, where instead of having to do the prep and have the colonoscopy procedure performed, you can actually submit a stool sample to have it analyzed by genetic testing to determine if you may have signs that suggest colon cancer. At that point, of course, you would have to go forth with a colonoscopy procedure. But some of the risk factors that we have that could impact that would be a high-fat, low-fiber diet, family history of colon cancer, obesity, race, because unfortunately African Americans suffer from colon cancer at a higher rate than Caucasians. But this, like I said, this is something that is definitely preventable and needs to be done for us to live longer, healthier lives. Another issue pertaining directly to all of us is heart disease. Heart disease is a blanket term which encompasses heart attacks and also discuss congestive heart failures and abnormal heart rhythms such as atrial fibrillation or VTAC. Heart disease, unfortunately, is one of the leading causes of death in men. Is the leading cause of death in men. There are many risk factors that come into play to this. Not being as active, diet, and of course, we're going to talk more about nutrition later on this evening. Diabetes, which will be discussed later on this evening as well. Stress. Stress has a large impact on our body, although sometimes we don't realize it can affect us as much. But testing, stress testing can be done by your primary care doctor or your cardiologist to get a better look at your heart condition, as well as getting EKGs, which can detect and show some signs of things that may be developing that can be treated as well. Diabetes will be discussed by Dr. Dees later on this evening, so I will skip the slide. And the last thing I'd like to touch on that we don't put a lot of emphasis on, and when we talk about men's health, we focus a lot on the physical, but we also have to discuss the mental aspects of it. As we all have known, we've been through a lot in the past few years, thanks to COVID, and we're seeing more issues where mental health is impacting a lot of things in our lives. And we've had the stigma growing up where someone said you have mental health issues, they labeled you as crazy, which unfortunately led to people not seeking the care they need and kind of bottling it up in. Unfortunately, this is a big thing with us as men. We feel like we have to be strong all the time and not discuss our feelings. And to discuss our feelings or show signs of struggle is a sign of weakness. However, this mentality can hurt us. And so there are subtle signs that we can see that would suggest mental health issues. Mental health issues include anxiety, it includes depression, bipolar disorder, schizophrenia, many different things. And unaddressed mental health issues can lead to physical issues. So some of the signs that we can look at to suggest mental health concerns, if we're getting angry or irritable frequently, we're changing in moods, we're having big swings from being happy to being tearful and sad, sleeping too much or not sleeping enough, changes in appetite, difficulty with concentration, turning to alcohol, drugs, or both of those things to cope with the stressors of life, feeling sad or hopeless, even some physical signs such as generalized aches that can't be explained, headaches or problems with digestion. As also we have obsessive thinking or compulsive disorder behavior, and of course signs that you want to in your life. And so if you see any of this, personally experiencing this or seeing this with others, please just interact, get involved, help them get the help that they need, because not addressing these issues can lead to bad outcomes down the road. So we just need to make sure we put a priority on our mental health as well as we do our physical health. And in closing, let's just make sure we're getting seen regularly by our providers, men and women as well, because we need each other. We need to be healthy and to live our life. And as has been stated earlier, that we know our body is a temple for the Holy Spirit that is within us. And we have an obligation to take care of this temple that we've been blessed with in order to glorify God. And so that is the end of my presentation. Let's see if there's any questions or anything else I can answer this time.
Dr. Rivers, you mentioned earlier. I'm sorry. You mentioned earlier that 50% of men have high blood pressure, and you covered, you said that stress brings on a lot of the health issues that we seem to have in the African American community because of a lot of challenges that we face.
Yes, ma'am.
So are there any additional things that we can do? I know that we have Prisma Health has a place for screenings in the evening. They have the Prisma Health's Community Health Men's Clinic that offers prostate screenings every fourth Thursday from 5:30 to 7:15, and it's located at 1801 Sunset Drive. For African American men, they said 40 to 69, they will do their screenings, and then for all other eligible men, 50 to 69, they will do their screenings. The phone number for that location is 296-2273. Are you aware of any other facilities that may offer free screenings? I know, I'm sorry.
No, go ahead. No, Sarah, thank you for sharing that information with everyone, because this is an excellent opportunity to get screenings done. I'm sure with it being affiliated with Prisma, that there would be low to no cost at all. And so that'll at least give you peace of mind to know that, hey, my numbers are in a good range. However, we still need to seek medical care, but this will at least give us guidance as to what our next step should be. Offhand, I can't think of any other organizations, but I could check with what Prisma and other health facilities have to offer. We can share that information at a later time, possibly in another form.
Thank you.
Thank you.
Dr. Rivers, there's a couple of questions in the chat. First one is, how accurate is the Cologuard testing as opposed to the colonoscopy?
Okay, thank you for the question. So the colonoscopy is the gold standard. That means this is the best test to get the best or most accurate results. Preferably, they would like to have the colonoscopy done because that would allow them to get direct look into the vessels. And let's say there's a polyp that's slowly growing, or they're not able to pick up any DNA changes, but that's what this Cologuard test does to see if you have any mutations or changes that would suggest cancer being present. It's not the most recommended. Those are reserved for those who have basically really no risk factors for colon cancer, but the standard test that will give you the most accurate findings of things would be the colonoscopy. So colonoscopy is still the preferred screening test.
Thank you. There's also another question, says, what about strokes?
Yes. So strokes, that can also be classified under the heart disease category. So what happens with the stroke is basically, it's almost like a heart attack of the brain. I say that as with strokes, there's a piece of plaque or fat or something that flows through your bloodstream. And that can go to the brain and it can stop the blood flow to that part of the brain, which causes the stroke. There are two types of strokes. There's a bleeding stroke, which only makes up about 10% of strokes. There's a thrombotic or ischemic stroke, and that's the one that's formed by clots. Depending on what part of the brain the blockage occurs, that determines what type of symptoms you have. There are certain parts of the brain where it would affect your ability to speak. There's some parts of the brain that affects your balance. There's some that affect your strength and weakness on one side of the body. But it also is impacted by high blood pressure, diabetes, high cholesterol, smoking, which cause your vessels to get smaller, which impacts your blood flow to the brain. So those are all things that could be best managed if you're able to cut down on those risk factors. Unfortunately, with us being here in the South, sometimes our activity level and our food choices are working against us, especially if we have diets that are high in fat and high in sodium, because sodium causes blood pressure to be elevated, which causes more stress on your vessels overall. And cholesterol builds up in your vessels, can break off and cause strokes. So we can help reduce our risk factors for strokes by doing the same things that we do for heart disease. Activity level, of course, is important. They recommend 30 minutes of moderate activity 5 times a week. That doesn't mean getting up and running a race. That can be just a fast-paced walk or a quick brisk walk in your neighborhood. But those are all things that even making little changes can lead to long-term gain and benefits. Okay. Are there any other questions?
Well, thank you so much, Dr. Rivers, for sharing that with us. We all learned a great deal. And one thing we didn't mention is that June is Men's Health Month. Is there anything you want to lift up in regards to that celebration that we do, just to highlight how important it is for the male component to take care of their health? And
Yes, absolutely. Because as men, historically, we've been less likely to follow up on healthcare, and so it's wonderful we have a month dedicated to it, to where we can realize that, hey, we have to make sure we take care of ourselves, and you can't pour from an empty cup. So we have people counting on us to make sure we stay healthy, and we have the obligation to make sure we live as healthy and as happy as possible, because we're all a unit, we impact each other. And so we need to make sure we are doing the best we can to take care of ourselves, and realize that we need to make sure we're taking care of our physical and mental peace as well.
awesome. Thank you so much. And you're an internal medical specialist at
At Prisma Health Richland. or
Thank
Prisma
you so
Health.
much.
So I do in-patient work. So unfortunately, I get to take care of the people who haven't really been able to manage those chronic conditions as well. And so I would love to not have to admit people for issues that could be prevented, but we just need to make sure that we're given platforms. And I thank you all for doing this tonight, to where we can get the word out to the community about how important it is for us to make sure we're taking care of ourselves to live happier, healthier lives.
Absolutely. Thank you so much,
All right.
Dr. Rivers.
All right, thank you.
Great. And so, Ms. Veronica Dees, if you can tell us a little bit about yourself, and also how we can prevent diabetes, which is very common to our community.
Good. Thank you so much, and good afternoon, everyone. Veronica Dees. Currently, I work for Prisma Health. I'm the Executive Director for Academic Development. However, my background, I've practiced as a nurse practitioner for almost 30 years, and a certified diabetes care and education specialist for 20 or so of those years. So diabetes certainly is a topic that's very dear to my heart, and one that I look forward to having a discussion about this evening. Are you able to see my screen? Am I sharing?
Yes, ma'am.
Okay, perfect. Thank you. And so the topic this evening, while there be some tips in that, I think that can certainly help with prevention of diabetes, I'm really thought about being that it is the summer months. I'm really thinking about diabetes and really managing some of those things within the summer and how the summer actually can impact diabetes. I thought that I would start, however, with the first, giving you just a brief overview of diabetes. Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. There are three main types of diabetes. Type 1 diabetes, which is more of an autoimmune reaction. The body really kind of attacks itself, making it something where patients who have type 1 diabetes need insulin. They cannot survive without insulin. Type 2 diabetes being one in which most often it happens when people are older, adults, although we are starting to see more children and young adults to have type 2 diabetes. And this is diabetes that most people will have and can take oral medications to really manage that particular type of diabetes. Second is gestational diabetes. With gestational diabetes, it develops in pregnant women. And during that time, the woman did not have a previous history of diabetes, but it's been noted to have diabetes during the pregnancy. Once the woman delivers, diabetes tends to go away. However, the baby then is at risk for developing diabetes later in their life. But that child also is at risk for being obese later in life. And the mother actually is at an increased risk for developing diabetes later on if she had diabetes during pregnancy. Also just wanted to quickly mention pre-diabetes as well, because that is certainly a topic now that we're hearing more about. And I think one of the key things about pre-diabetes is that, yes, it can be prevented. So you might be diagnosed or told that you have pre-diabetes, but there are lifestyle management changes that you can do that can really impact pre-diabetes and put you in a state where you're no longer considered to have pre-diabetes. That can also happen for type 2 diabetes as well, that management of your diet, exercise, your weight can also improve type 2 diabetes. And in some instances, people can actually come off medication, those who have been on medications for type 2 diabetes. In the United States, 1 in 3 adults has pre-diabetes. More than 8 in 10 people with pre-diabetes don't know that they have it. So I think that kind of speaks to what Dr. Rivers talked about earlier, and the importance of being screened and being able to see a provider so that you can get those routine screenings, so that you're able to know what things you're dealing with, and being able to put different measures in place that can help prevent some of these things. So who's at greatest risk? Some of those non-modifiable risk factors include your family history, a parent who might have diabetes, a sibling who might have diabetes, race or ethnic background. We know that African Americans, Native Americans tend to have a higher risk of developing diabetes. Age is also one of those non-modifiable risk factors. So the older we get, there is an increased risk of potentially developing diabetes. And as noted earlier, gestational diabetes is also one of those non-modifiable risk factors. And so some modifiable risk factors are things that you can actually control. That is your weight, physical activity, blood pressure, keeping your blood pressure in a normal range, smoking, not smoking. Is one, again, as a risk factor that puts you at increased risk for having diabetes. But of course, they're all modifiable, meaning that there are things that you can do as an individual to improve those particular risk factors. Wanted to also give a little bit of statistics here just to bring awareness. The prevalence of both diagnosed and undiagnosed diabetes, 38.4 million people of all ages, or 11.6% of the US population had diabetes. This is data from 2021. 38.1 million adults age 18 years or older had diabetes. 8.7 million adults aged 18 years or older who met the laboratory criteria for diabetes were not aware or did not report having diabetes. And this number represents 3.4% of all US adults. And so I do think it's important to note that we have so many people, yes, who are potentially walking around not even aware that they actually have prediabetes or that they're actually diabetic. The percentage of adults with diabetes increased with age, reaching 29.2% among those aged 65 years or older. The next slide here, just some statistics from 2020, but it's really specific to South Carolina, and I just thought it would be important to also note kind of what's happening within our state. So 2018, South Carolina had the 8th highest prevalence of diabetes. Approximately 1 in 6 African Americans compared to 1 in 8 white adults diagnosed with diabetes. 1 in 4 over the age of 65 have diabetes. Since 2011, diabetes prevalence among adults has increased from 12.1% to 13.3%. And a very interesting statistic here is 1 in 5 adults with less than a $15,000 annual household income has diabetes. I think that's important to note when we think about what's required to manage diabetes. Being on medication is important, and you're having to get that. Your diet is also important. So nutrition, being able to have access to fresh fruits and vegetables. And if you think about 1 in 5 people are living with less than a $15,000 annual household income have diabetes, I think that speaks to why we probably have a lot of the complications that we have from diabetes, and the importance of really being able to identify where resources are that can support financial resources, as well as some of the free screenings that might be out there, really just to help improve some of those outcomes. Diabetes is the 7th leading cause of death in African Americans, 2 times higher death rate compared to white residents. 4 of 5 people with diabetes are overweight or obese. 7 out of 10 have hypertension, and 2 of 3 have high cholesterol. Again, speaking about diabetes, but also noting some of those other chronic illnesses that really can impact diabetes and management thereof as well. And so now to delve a little bit more into really kind of summer, and what does summer have to do with diabetes? So it's important to note that heat does affect people with diabetes more. So if you have complications from diabetes that has caused damage to blood vessels and nerves, that can affect your sweat glands, causing your body to not be able to cool as effectively. High temperatures can change how your body uses insulin. And because of that, there is a need for testing more frequently. And that testing more frequently might mean you having to adjust your insulin dose more. And also means just really paying closer attention to what you eat and drink, because it might impact your blood sugars differently compared to when we weren't having the temperatures are as high as they are right now. Dehydration is something that happens more quickly in people who are diabetic, and particularly during the summer months. So not drinking enough liquids, we know can raise blood sugar levels. And of course, high blood sugar levels can cause frequent urination. So frequent urination then can also cause dehydration. So that can be a cycle that can lead to other complications, and unfortunately can land someone actually in the hospital as a result of that. So very important to be aware of dehydration and really drinking lots of water and replenishing those fluids. An important thing to note, knowing that so many people who are diabetic also have hypertension, oftentimes one of the treatments that people might be on to help manage their blood pressure is taking a diuretic or a water pill. And so water pills can also cause dehydration. So in thinking about just the fact that you're diabetic, that also puts you at risk for dehydration. Then you add on top of that, taking a water pill, that can also cause dehydration. Just again, so important to stay hydrated, and to stay hydrated with water versus some of the other more refreshing type of drinks, lemonades, teas, sometimes that we like to engage in. And so diabetes management, while it incorporates a number of different components, each of these components can be impacted by our summer temperatures. And because we tend to do things a little bit differently in the summer, that's physical activity, our nutrition, sleep hygiene, and blood glucose monitoring. So I'll go into a little bit more detail regarding each of these things. So from the physical activity standpoint, so we do encourage and want you to be active. Being diabetic or not being diabetic, do encourage that to be something that you do. Important to note, however, with our temperatures, and particularly right now with our temperatures where we're getting up to 100 and plus degrees, just keeping in mind that exercise, while it's very important, being able to exercise, particularly if you want to do that outdoors during the coolest times of the day, so early morning, late evening. Again, thinking about the fact that if you're out in temperatures where it's really hot, you're sweating, your body, particularly if you have complications from diabetes, may not be able to help you cool down effectively. Consider working out at home, especially if you have air conditioning, or going to an air-conditioned place such as the mall or the gym. Recommendations are certainly to engage in 150 minutes, that's 5 days a week, 30 minutes of activity, moderate to vigorous aerobic activity per week, engaging in 2 to 3 sessions a week of resistance exercise on 9 consecutive days. So essentially making sure that you're doing some type of exercise that leads with, that has resistance. That might be lightweight training, that might be the use of resistance bands. Again, 2 to 3 times a week, that might be a routine of Monday, Wednesday, Friday, or maybe it's Monday and Friday you choose to do that. But the importance of being able to do that also is important and really key in helping with our bone health. Also engaging in flexibility training and balance 2 to 3 times per week. And this is particularly important for older adults with diabetes. Sometimes complications from diabetes where there's nerve damage, balance can become an issue. And so engaging in yoga and Tai Chi can be some helpful exercises that can really support flexibility and balance. Nutrition. So summertime, while it's lots of fun, can be filled with picnics and cookouts and barbecues. And it is a time that people tend to eat lighter because we tend to have more access to fresh fruits and vegetables. Each of those things can certainly be good for diabetes, but certainly with caution. Particularly with watermelon during the summer. Lots of people like to eat watermelon. I tell patients all the time that while it can be freshen, it's good, it's light, it is one of those fruits that is considered a high glycemic food, meaning that when you are eating it, when your body digests it, your blood sugar almost immediately will start to rise. And so the more that you're eating of that, the more likely it is that your blood sugars are going to be elevated and causing problems with that. So do caution, while yes, eating fresh fruits is really important, still being aware that fruits, when your body digests them, they are like sugar, so they can also increase your blood sugar. Another thing, particularly during the summer months, we are doing cookouts, barbecues, grilling. But remember that food should be cooked all the way through. So color isn't necessarily the best way to determine doneness, but really making sure that food is cooked to that right temperature. And why is that important? It's important because developing or getting a stomach bug during the summer, particularly, it's going to be bad for anyone, but particularly if you're diabetic, really can cause there to be a lot of issues and oftentimes can lead to hospitalization as a result of that. So really keep that in mind, that making sure your food is cooked all the way through. Perishable foods like salads, cheese, meats, dips, making sure that they're not kept out longer than 2 hours. Anything longer than that really should be thrown away. And so here it noted reheating leftovers actually can kill any bacteria. So sometimes we think, oh, well, we just reheat it, that'll kill the bacteria. But important to note that it does not remove the byproducts that the bacteria create. And so that is something that could also make you sick. So a good rule of thumb is to eat hot foods while they're still hot and cold foods while they're still cold. Encourage people to think about dividing your plate as well. And so oftentimes it might be easy to overeat, but helpful to think about dividing that plate, making half of the plate with vegetables. It can be a salad or it might be raw vegetables. This is the time of year where vegetable platters or those plates are really easily accessible, easy to find in the markets and that kind of thing, but really thinking about half of that plate being vegetables, a quarter of that plate being protein, so that could be your chicken, and then the last quarter of the plate being carbs. That could be corn on the cob, it could be the bun for your burger, or it could be a fruit salad. Again, thinking about the quantity and the amount of the fruit salad, because once again, as your body digests that fruit salad, that fruit, it can raise your blood sugars. So being mindful of that, as well as alcohol intake. That is something to also keep in mind, that alcohol intake impacts your carb count. And so you will need to make adjustments if you choose to engage in, alcohol as well. Sleep hygiene, while I think it's really important for people who are diabetic, but I also think it's important for those who aren't diabetic, our sleep really can have major impacts on our health and overall overarching well-being. So sleep disturbances are under-recognized factor in type 2 diabetes, as it certainly has been associated with insulin resistance, pre-diabetes, and diabetes. And it is definitely known that lack of sleep can cause a significant impact on glucose levels. Obstructive sleep apnea affects 2/3 of people with diabetes. Poor sleep will worsen prediabetes or diabetes. And so some sleep promoting routines, certainly that I encourage, again, not just someone who's diabetic, but for any of us, really is establishing a regular bedtime and rise time, creating a dark, quiet area for sleep with temperature and humidity control, establishing a pre-sleep routine where we're putting electronic devices in silent or off mode, avoiding those daytime naps, limiting caffeine and nicotine in the evening, as well as avoiding spicy foods at night and avoiding alcohol before bedtime. Again, sleep hygiene is just really, really important. And again, those are tips that it can be important for anyone in promoting a good sleep. Blood glucose monitoring. So much happens and our routines are often disrupted during the summer. because we're going on vacation, we're traveling, going to family reunions, or we're engaged in other summer activities. And these activities really can throw off our normal management and how we manage blood sugars. So just remember to check blood sugars more often, making sure that it's in that target range. Again, sometimes we tend to be a little more active during the summer. So what may have been blood sugar ranges that you were very comfortable with because you were exercising maybe 3 days a week. And so you kind of knew what that range was. But during the summer months, you're out more, the sun goes down later, so you're outside maybe a little longer than normal, walking more than normal. That really can impact your blood sugar levels in a positive way, but it can also put you at risk for having low blood sugars. So I definitely encourage you to monitor your blood sugar more frequently and be aware of the signs of low blood sugar and what that feels like for you. And then being able to know those ways of being able to treat it. If you notice it right away, treat it right away. And that's important for even family members to know when your blood sugar might be low. What are those things and ways to treat that? Oftentimes we think about drinking orange juice or there's glucose tablets that you can have as well. That can support, if you have a low blood sugar, being able to quickly cause that blood sugar to rise. So if you are on insulin or taking medication for diabetes, the temperature can impact your insulin, as well as it can impact the medications and how effective it is. So you don't want to store insulin or oral medication in direct sunlight or in a hot car. If traveling, want to keep the insulin and other medications in a cooler, but we'll caution that you don't want to put insulin directly on ice or a gel pack, as that freezing temperature can impact and cause your insulin to freeze. And hot temperatures can, as well as too low of a temperature, can really impact the effectiveness of the medication. So while most of us will tend to throw away the package insert that might come with our medications, I do encourage taking a look at that so that you have a good sense of what are temperatures that's too high for where you want to store your insulin or your oral medications, as well as temperatures that might be too low, so that you're making sure that you're staying in that range that actually makes your medications where it's going to be effective and you're not going to have issues that you weren't thinking about. So heat can also damage your blood sugar monitor, your insulin pump, or any other diabetes equipment. So again, just really thinking about and being cognizant of where you're placing those items. And so when you're thinking about that blood sugar monitor, making sure that it is in a place where it's room temperature, and not putting it within your car, or not putting it, if you're at the beach, leaving it out somewhere while you're at the beach in a bag, for instance, because the temperature even at the beach can still, cause it to be too high and impact the ability for that blood sugar monitor to be able to work appropriately. That is also true for test strips. So you may be thinking that your test strips are good, and because they've been sitting out in the sun, you might get false readings. So really, again, important to just think about how those temperatures can really impact the equipment as well. And so in conclusion, I do want to leave you with a couple tips and something to think about as you're thinking of that summer checklist. Again, drinking plenty of water, want to prevent dehydration from happening, testing your blood sugar often again so that you're able to keep your blood sugar in the range that is appropriate. Keeping medication supplies and equipment out of the heat, staying inside in the air conditioning when it's hottest. Again, still want to encourage exercising, but if you're going to exercise outside, make sure you're doing it during those cooler times of the day, early morning, late evening. And thinking about your clothing, wear loose, light-fitting clothing, light-colored clothing as well. Again, just remembering that for some people, those complications of diabetes may cause their sweat glands to not work effectively, and they're not able to effectively cool themselves down. So wearing clothes that's loose or light clothing can help with that. Very, very important that to seek medical attention immediately for any heat-related illnesses If you have a stomach bug, definitely want to be seen immediately, particularly if you're diabetic, because that can cause complications, dehydration as well. If you're feeling signs and symptoms, you're nauseated, headache, you're lightheaded, any of those kinds of things. You've been out in the sun all day, you're feeling those kinds of things. You try hydrating with water, but you're still not feeling better. Really just go have that checked out. Check with your primary care provider, because dehydration, as well as any type of virus, really can have a major impact on your body, on your blood sugar control. Something I didn't really talk about, but making a plan in case you lose power. So hurricane season, I believe, started June 1st. And so we're at risk for those high temperatures and then thunderstorms, and that puts us at risk for power outages. And so, of course, if you have insulin's in the refrigerator, your power goes out, then the refrigerator is out. So then that decreases the temperature in the refrigerator, can causing that insulin to not work effectively. So just always have kind of a plan for if you were to lose power, and also encouraging having that bag that you can easily grab if you need to. We don't tend to see that much here in South Carolina, but in some other states, a power outage that might mean you can no longer stay at your house and you're needing to go somewhere else, to a shelter, to a hotel, whatever that might be, but just really having a bag handy for emergencies, so you're not trying to find those things that you need to help you to manage your diabetes. So that kind of concludes what I had this evening to share. And so thank you so much again for the opportunity to talk about something that's very dear to my heart, but happy to answer any questions. Thank you.
Ms. Veronica, there's a couple of questions in the chat. One is, can you give us some more information on diabetes and veterans who have been exposed to Agent Orange?
Sure. So it is known, yes, that Agent Orange can impact diabetes. I think it's one of those things that the management of diabetes is going to be important, and that your primary care provider understands if you've been impacted by Agent Orange and some of the complications that can happen as a result of that. And so because that can be something very specific, I wouldn't necessarily give generalized information, because it can be individualized based on when you were exposed, how long you were exposed, and some other family history that can impact maybe what's happening as a result of that. But it does impact diabetes and can lead to some complications that you're seeing in diabetes that can also lead to the inability to manage diabetes well. So I encourage that connection with the primary care provider, and making sure that that primary care provider is aware of the fact that you were exposed to Agent Orange. But I would say it's a very individual kind of thing, so I wouldn't want to give information that could potentially not be relevant for all.
Thank you. There's another question. What are some fruits that will have lower impact on your blood sugar?
Sure. So what I actually encourage, patients to do oftentimes is really thinking about the serving size of those fruits that they might be taking. And so grapes, for instance, doing, a smaller number, it might be 10 or 15 grapes that you might do. But the other thing is to include like a protein along with that fruit. That would also help with that. So watermelon is one that's high. Bananas are another thing that's high. So definitely encouraging something like grapes, blueberries, other types of fruits like that you really can control the amount of them. Would be helpful, but also adding that protein with it slows the rate by which your blood sugar is going to increase. But those are a couple of the higher things. So bananas, for instance, rather than doing one large banana, cutting that banana in half. is going to also be beneficial. But making sure that apples are another that isn't high on that glycemic index. But again, if it's a red delicious and it's a large apple, you don't want to eat that whole apple. You want to do half of that apple. So although it might be high on that glycemic index or lower on that glycemic index, being mindful of the portion size is really going to help with managing the impact to your blood sugar.
One more question. Well, there's some symptoms that individuals need to pay attention to when they may be pre-diabetic.
Sure. And so the thing about pre-diabetes sometimes is that you may not necessarily have those symptoms that you see when someone truly is at that diabetic range, frequent urination, frequent thirst, weight loss. You may not see those things, but what you might notice is that you feel funny. You don't feel like yourself after you've eaten what would be considered foods that are high and that can cause your blood sugar to be elevated. So your desserts. So you've eaten a dessert and you notice that after eating that dessert, oh my gosh, I feel really tired. I'm feeling really sluggish. And that hasn't been a norm for you. So that could be something that you're saying, hey, I've noticed when I do this, I feel this way, something to check out. It might also be one of those things that you notice that if you go for longer periods of time where you're not eating, that you don't feel well. And so that can also be a sign of fluctuations in your blood sugar that can really be a sign that maybe you're pre-diabetic. Women, particularly perimenopausal women, menopausal women, oftentimes will have very similar kinds of symptoms and they're thinking I'm just having hot flashes and that's what's going on because they're perimenopausal, menopausal, but that also can be a sign that there's some fluctuations in your blood sugar and important to get that checked out. But oftentimes pre-diabetes, you don't see the frequent urination or the frequent thirst or that, immediate kind of drop in your weight. So I would just say that, being able to see your primary care provider, seeing a provider, being screened regularly once a year is going to be the best thing to help in identifying pre-diabetes, or if you just don't feel well. Because sometimes, we tend to be guilty of we don't feel well, but we still have things to do. So we just keep doing and we keep going. And so as Dr. Rivers said earlier, just really taking the time, being mindful of what's happening with our bodies and seeking and, taking advantage of screening, but also making efforts to get ourselves taken care of and looking at ways that we can do things to make ourselves better.
Thank you.
I have another question that I kind of for myself. I'm an eye care provider, so I see a lot of patients that are pre-diabetic and they're on metformin. Is that like a common practice, or to put them on it as a preventative method?
Yeah, it is a common practice to do that, and actually can be very effective in helping patients to reverse that pre-diabetes state and not becoming diabetic. I do caution that while I think medication is important, I also think there's some things that we can do before that. And that really is those lifestyle types of things. And so we don't, I think, talk enough about how our weight impacts us, the nutrition and what we're putting in our bodies is really impacting us. And so, I am a provider and yes, I prescribe medications, but I'm also that person who knows that food can be medicine and really encourage our patients to really think about what you're putting into your body, what you're eating, because it does impact that. And so while metformin is one of those things that's used, I've used it, it does work, but I also think it's important to do those things like monitoring your weight, exercising, watching what you're eating, because those things are going to be the things that's going to sustain you. And we know that medication, sometimes there are side effects of medication. So metformin in particular, one of those things is that people can have stomach issues with metformin. Eating healthy and exercising doesn't cause that. And so when we're thinking about being on medication, there are other sides to it. It can work, yes, but we also have to think about some of the other side effects that might happen. But do encourage that regardless of what you're on, medication or not, don't forget those lifestyle kinds of things, such as nutrition, exercising, and sleeping, and, just having good sleep habits as well.
Thank you. I do not see any other questions in the chat at this time.
Thank you.
Thank you so much. We really, really appreciate that and the effort to dispel several myths. I know I learned a lot about, fruits. You can't trust every fruit, or at least as it's been told to me, too much of anything is bad for you. And a lot of times we think fruit is, a good alternative to some of the processed things, but it also has a lot of the sugar and be very harmful to our health. So thank you so much, Dr. Diaz, for sharing your insights. And I think we're going to move to Ms. Faith Palmer's demonstration on the nutrition of a salad in a jar.
Okay, well, good evening, everyone. I'm so happy to be here. I am Faith Palmer. I am a certified coach with Optavia, and I specialize in just leading people down a health and wellness journey, and mainly focusing on weight loss, but also focusing on other things. So one of the things we do to just add a little spice to some things and some enjoyment is what we call a salad in a jar. So sometimes you think about a salad, you think, oh, that's just boring, I don't want a salad, I don't enjoy eating salad. But it's one of those things that is can really be something that you can enjoy. So one of the ways that I like to approach it is with this salad in a jar. So we're just talking about a regular mason jar, the good old fashioned mason jar. So this one is a pint-sized mason jar, but you can use any size mason jar. You can use pint size, quart size, the gallons, or whatever size you like. But the pint size, I believe, is just a great size for a nice size salad. And so we do the salad in the jar to give it some enjoyment, something that we can enjoy doing. So with the salad in a jar, it can last in your refrigerator 4 to 5 days in your refrigerator without getting soggy, and your vegetables will stay crisp. But it's in the way that you prepare the salad in a jar to keep the freshness of it. So one of the things we do with a salad in a jar, we want to start with our salad dressing. And so, Dr. Rivers and Steve, they talk so much about all of the health issues and things. So we want to make sure eating healthy is one of the things that we're doing, because that helps everything. If you have diabetes, you have heart disease, you have prostate, whatever, eating a healthy diet really does help all of those things and managing our weight. So we start with our salad dressing first. And so I like to before I'm a health coach. And so before I became a health coach, I did this program that I worked for. And so I didn't, I always wanted salad with my dressing. I loved a lot of dressing, but now I can manage it. I don't need to eat a lot of, a dressing with my salad. But depending on the size jar, you can do maybe anywhere from 2 to 4 tablespoons of dressing. So you want to start with your jar. So we have our empty jar here, and we want to measure out some dressing, and we want to put that in first, because we want our dressing to be at the bottom so that it does not get our veggies soggy. So I'm going to do about 2 tablespoons of dressing, and I'm just using a balsamic vinaigrette today. But I'm just using, this is a light Ken's balsamic vinaigrette. Of course, making your own dressing is optimal because you know exactly what's in it. But this is a quick way to do it. But I have this one, Ken's balsamic vinaigrette, or I have another one, G. Hughes. I don't know if you're familiar with it. Makes great sugar-free dressings, barbecue sauces, things like, and they taste really good. They don't taste sugar-free. So I love G. Hughes as well. So I have my dressing in the bottom. And so the first thing you want to do, your first layer, you're going to do your hard vegetables first. So your hard vegetables are things like your carrots, your bell peppers, broccoli, fresh broccoli, cauliflower, things like that. So tonight, I don't have a whole lot of things out here, but I got a pretty good variety. So I have some bell peppers here. So we're going to put that in first, because we're going to put our hard vegetables in first, because they don't get soggy in the dressing. So that's why you want to start there. And so I got some bell peppers I put in here. Let's put a few cucumbers in here as well. And I wish I had some broccoli, because that's really good, because that's a hard vegetable. So we got some broccoli in here. Don't have any carrots today, but if you had carrots, broccoli, those things, cauliflower. So your next level is going to be your softer vegetables. So you have some things like tomatoes, your onions, corn, avocado, things like that you could add on that layer. So I have some tomatoes here. So I have some cherry tomatoes here. So you can just throw those in there in the bottom. You can see it's starting to get some things in there. Okay, and I think we have some onions. I chose some red onions today, so I chopped up some red onions. And throw some of those in there, and I can put in some onions in your salad. All right, and so those are the softer vegetables that you may want to include in your salad. So then your next level will be your protein. So you can do some shrimp, you can do some cooked shrimp, you can do some chicken, you can even do some beans, black beans, some type of beans in there as well. And so you want on that layer some hard-boiled eggs, all of those things. So I don't have any protein meat as far as I have some hard-boiled eggs here. So you just put some hard-boiled eggs in here as well, on this layer. And so we're layering it so that it does not get soggy. Okay, so we have our hard-boiled eggs. And so this is another layer that you could put your meat if you wanted to put some type of other protein in. And so then after you've gotten that on there, you could put a wide variety of things. You can put quinoa, just all kinds of vegetables. It's no specific type of vegetable, but the fun part of it is just making the salad. I like colorful salads, so having a lot of options. And so sometimes I do salad in the jar parties. And so we get together and everybody, we have the tables just covered with all types of toppings that you can add to your salad. Okay, so we got this in there. You can put as much in there. You want to put a lot in there to get, your salad in there. And you top it off with, and normally I would have far more things in here, but we'd have some beans and you could even put rice in there. Some people do rice and quinoa, all types of those things, but don't want to do too starchy of things if you have diabetes and things like that. But you want to monitor that. But once you get everything in here that you want with those things, you want to top it off with your greens. So this is where you put your lettuce in here. So I have some spring mix here that we'll include, and I have some also some other lettuce as well that we can also romaine that we can put in here. And so you just really want to pack the lettuce down in here. So get as much lettuce in here as you can, because you want to just pack it down in here. So I have some of this romaine in here, and I'm gonna put some spring mix in here. I like spring mix. I like fresh spinach in my salad. So put those in there, and you just really want to pack it down in there as much as you can get in there to pack it down. And then once you have all of that in there, you can top it off if you like. If you want to top it off, you can put more in there. You want to just really pack it down. You can top it off with some cheese or some nuts and things like that. So I have some shredded cheese. This is a Mexican mixed cheese here that I'm going to top it off with. You can put some fruit in here, fresh fruit. I have some almonds I'm putting in here. And so your dressing, like I said, is at the bottom. You have all of your veggies in here. You've packed it down with lettuce. We can probably get some more lettuce in here if you want to, but you really want to just push down in there. And once you have everything in here that you want, you put your little seal on here and put your top on here. And you can label it with the date that you prepared it on the top. And this lasts in your refrigerator 4 to 5 days. So a lot of people may have, get all their ingredients, prepare several of these for the week. And then you have them already. You can take them to work with you. You can pull it out and eat it for dinner. They're already prepared. You don't have to worry about pulling everything out every day to make your salad. But when you are ready to eat it, all you do is just shake it up, because you have your dressing in here, and you want to shake it up to get your dressing to mix in with it. And you can eat it out of the jar, or you can put it on the plate, whatever you like. But this is just a fun way and a healthy way to get all your veggies in a way that you can store it, that you don't have to prepare a salad every day from scratch. So do you have any questions about salad in a jar?
Could you tell me what the name of that dressing was that you mentioned earlier?
One of them that I use, this is Ken's balsamic vinaigrette. This is a light version. I really like this one, but they have several others. But then this one is African-American gentleman, G. Hughes, makes this one. This is a sugar-free sweet vinaigrette, but it's sugar-free. He makes a lot of other dressings as well that are sugar-free, barbecue sauces, marinades, all kinds of a line of sauces that he uses. And you can find this in your dressing aisle and all the other sauces. And I like pretty much all of his because, you know, it's sugar-free, but you don't want it to taste sugar-free, and it tastes really good. So I love his line of sauce, and I love Ken's as well. So these are kind of my go-tos. We use a lot of other dressings as well. I like the Olive Garden dressing. They have a light version, which is another good dressing to try. But I try to stick with the light version because when you're using a dressing that's in a bottle, they add a lot of sugars and things to it. That's why I recommend if you make your own dressing, there are recipes that you can make your own dressings as well. And so that is a good way to go about it, having your, preparing your own dressing. And you can find many recipes, healthy recipes for salad dressing online. But with the salad in a jar, you can always Google salad in a jar. And this is just a picture of how the layers should be. Because you want to be careful with, how you put them in there, because you don't want a soggy salad. If you're going to put it in the refrigerator for 4 to 5 days, if you put certain vegetables on the bottom, they will definitely be soggy and will not be enjoyable. You want your greens to be crisp and, when you eat your salad. So you can always look for this online, and it gives you the suggested layers of your salad and what it should look like. But depending on how large of a salad you want, it depends on what jar. I like the pint size. It's just a good side salad. Are there any other questions?
Well, thank
Thank
you.
you, Faith.
Okay, thank you. Thank you so much.
I don't know. Yeah, I see Wanda Gilliard is online singing your praises. She says you are her health coach. And so if there, she's saying she feels like Palmer as my healthy life transformation of my temple. And so we thank her for her testimony, and we thank you for sharing this. If someone wanted to connect with you and maybe take part in some of your coaching services, how can they connect with you?
Absolutely. I would be more than happy for them to connect with me. Wanda is one of my clients. She has done phenomenal job. She lost 70 some odd pounds on our program. And now she is a health coach as well. And so she helps people to health and wellness, leads people to health and wellness as well. I have a QR code that people can scan if they are interested. It takes them to what I have a jot form. I don't know if they will be able to get it from here. But if they want me to drop the link in the chat, I can do that as well. But this is a QR code that will take them to my jot form. And it's just a health assessment that we ask them to complete. And then I meet with them on Zoom to tell them about, I do an assessment of their health assessment, take a look at it. And I tell them what program, because every program is not one size fits all. And so we have, multiple programs, and I would figure out the right program for them. But I'm very passionate about it because our community really suffers in this area. A lot of times we just take our health for granted. And then when we become ill, we're wondering what happened, but we just don't typically eat the way we should, and we don't watch our weight and watch those things. So I would love to connect with people. I could drop it in the chat for my health assessment. And I would be more than happy to share what I do with them. But thank you for asking.
Absolutely. Yes, ma'am. I feel healthier already thanks to our panel. I really do. And they say, health is one of those things. If you don't take care of it, it will leave you. And so we thank you so much for helping us to live happier, healthier lives. And if our hearts and minds are clear, we're going to dismiss Do you all have any final thoughts that you want to share, maybe in a brief statement on why this is pertinent to our community and health and congregation as
I
far as
do.
men's health? Mhm.
Uh, this is, my name is Sarah Gay. I'm a public health nurse. And so in my role as a public health nurse, we take care of the community. We look at the entire community, all aspects of it. And I thought tonight that this was a great opportunity for us to share as much knowledge and wealth with our community in order to heal ourselves, heal each other, and take care of one another in so many different ways. And what better way to do it by starting with the church. I love First Nazareth Baptist Church because of the fact that it gives us an opportunity to do so many great things. We receive so much food, spiritual food, and now we're learning about the nutritional food that we also need for our lives in order to have better lives. One of our nutritionists was unable to be on this evening, but she left some information for us where individuals can go. She said to the City of Columbia GIS landing page, and it will show you where to find grocery stores and farmers markets in the areas. And Home Food Share, South Carolina, it's called foodsharesc.org in order for individuals to go and receive food share packages as well. And thank you for the opportunity to be here this evening.
Thank you all so much for joining us. You all have a blessed night. Take care. Tell a friend to replay.